Okay, good evening, everyone, and thank you for joining us. I'm Anjali Malik, MD. I'm a breast imaging radiologist in Washington, D.C. And if you got to come to our main summit back in July, you know that I am super passionate about breast imaging, breast health, and breast cancer. And of course, it's October Breast Cancer Awareness Month, so it's on everyone's mind. So I collected some other wonderful South Asian ladies who are, for various reasons, tied into the breast cancer and breast imaging community. I want everyone to introduce themselves. This is live on YouTube, so if you have any questions, you can still type them into YouTube, and we will be sure to address them this evening at the end or throughout if it makes sense. So Amani, why don't we start with you?
Hi, I'm Amani Jhambekar. I'm a breast surgical oncologist in Houston, Texas. I recently finished my MBA at IU Kelley School of Business, and I did my fellowship at Columbia. So I am also extremely passionate about educating about breast cancer and prevention and all things breast health.
And you also have amazing travel photos that give me, definitely during COVID, a lot of FOMO, but in general, FOMO as well. We have other physicians with us. So Reema, why don't we move on to you? What brings you to this talk today?
Hi, everyone. Thank you, Anjali, for including me. I'm Reema Jawaria. I am a gastroenterologist practicing in Allentown, Pennsylvania. I got diagnosed with breast cancer last November from screening mammogram. And that I've been sharing my journey for those of you who have been following me on Instagram, Daily Dose by Dr. J, which I started 2 years ago, actually in October, because of my sister who was diagnosed 4 years ago, just to spread awareness and make women aware of their health and preventative medicine. So that's why I'm excited to be part of this talk.
Sure, and I love connecting with you. You have wonderful posts. We'll share everyone's Instagram handles afterwards if you haven't already gotten them through the South Asian Docs Instagram, but definitely a lot of great pages here. Simran, why don't we go to you?
I'm Simran Malhotra. Professionally, I'm board certified in internal medicine as well as palliative care and hospice. So I'm actually a practicing palliative care physician. So I work with a lot of seriously ill patients. And personally, I have a very strong family history of cancer. And I myself am a BRCA1 genetic mutation carrier and a Previvor. So I basically am at high risk for certain cancers like breast and ovarian cancer, but I haven't had cancer. And I'm really excited to be here. So thank you.
Yeah, and we're so excited to have you here and to learn more without revealing too much right now. But thanks for that intro. And last but not least, Roshni.
Hi, I'm Roshni Kamta. I'm not in the medical field professionally, but personally, I got diagnosed with breast cancer last year at the age of 22, last April. And I just finished radiation in end of February. And I really used my social media to connect with other young women who are going through breast cancer, because I felt like I was the only one, and talk about the realness of going through cancer at a young age, and also because I am an Indian woman, to destigmatize cancer as well.
Absolutely, and so important. And you and I got to connect. Well, I found you actually through some of the work that you've done on Instagram, and then we did the Woke Desi podcast last year, who are wonderful supporters of Sawas as well. Okay, well, we got some good intros. We'll go into each of those stories. So Simran, why don't we start with you? So you mentioned that you are a BRCA1, or that you have a BRCA1 mutation. So I'll just give my little brief intro to that, and then we can go. So we know there are a lot of genetic mutations that can be related to hereditary cancers. And in the breast world, BRCA1 and 2 are the two most common, but again, not the only ones. They were catapulted into notoriety with Angelina Jolie in the mid 2000s, who did have a double mastectomy, revealing that she had a BRCA diagnosis. And of course, we know that it does affect women most commonly in the Ashkenazi Jewish population and also Black women. But of course, that doesn't mean that South Asian women can't get it. As Simran, I'm sure you'll tell us a little bit more about it. So you mentioned you have a strong family history of breast cancer. And in some of your posts, you've been telling us a little bit more about that. So when did you decide to get genetic testing to find out that you had BRCA?
So I guess kind of going back, my story starts with my mom. So maybe I'll start from there and then kind of work my way to tell you how I got to testing. But
Sure.
She was diagnosed with breast cancer when she was 33.
Yeah.
I was 13 at the time. So, you know, she was otherwise healthy. She went to her doctor with a breast lump, and her doctor told her, "You're too young to have cancer. It's not cancer," and kind of sent her back. And actually, she ended up getting diagnosed in India. We're from Canada, but we went on a trip, and she told her sisters in India she had 2 biopsies there, which showed her that she had cancer. We came back to Canada after our trip, and she had a biopsy showing that she had stage 1 triple negative breast cancer. So lumpectomy, chemo, radiation, and at the time her genetic testing was actually negative. So that was kind of like the only known cancer history in my family that I knew about, at least at that age. I didn't even know what cancer was then. But fast forward to 2013, I was a 2nd-year medical resident. My mom's older sister, 58 at the time, got diagnosed with an aggressive form of ovarian cancer, or primary peritoneal cancer. So it's she had surgery, she had chemo, she died a little over a year later. It's actually her birthday today. And after that, sorry.
So sorry to hear that.
Yeah, that's a lot.
It's ironic. So fast forward after that, I was a resident by then. And, you know, after her diagnosis, I started asking a lot of questions about my family history. And at that point, we found out like there was a lot of women on my mom's side with breast and different types of reproductive cancers. And the youngest was actually in her 30s when she was diagnosed with some form of reproductive cancer. And I say some form because the more I've asked questions, the less answers I've gotten, because no one wants to talk about what the diagnosis was or who got it or what, you know, culturally, it's not something anyone wants to talk about. So my mom and I, from what I know, in our whole family, are the only ones that have gotten tested. And so in 2015, she basically 2013, she got tested, and this time she was positive for BRCA. And after that, ended up getting like the total preventative hysterectomy. And that year I was 26, just finishing up residency, engaged, and decided to get genetic testing, found out I was positive. So basically my genetic counselor and my initial set of doctors all said, like, based on your family history, you need to get preventative surgery as soon as possible. So I always knew it was in my future. And so we got married a few months later and ended up having our kids 19 months apart, back to back, all around the fact that I knew I was going to need to get these surgeries as soon as possible. And in the middle of all that, we got thrown a curveball in 2017. My mom was here, had my newborn in Maryland, and she went back to Canada to get her screening MRI, and it showed DCIS. So given her history and everything, they were like, you need to get a mastectomy right away. And she did. She had a flap reconstruction. And I'm bringing this up because on the final pathology, they actually found a 2 millimeter, so tiny, but invasive ductal cancer in the opposite breast. So super aggressive. And if she wasn't getting her screening MRIs, you know, this would have been diagnosed much later, much more aggressive. And I don't know, you know, where we would be today with if she didn't have that screening MRI. So I tell everyone, like, it saved her life.
Sure. And I want to get into what you've gone through recently, but you've hit on so many talking points that, and I don't have a pen and paper because I came unprepared. So, but a couple great points from what you said. I Absolutely. And part of why we're doing this and part of why SAWAS exists in general is the stigma and the whole like secrets of the South Asian society. Like we don't talk about it. We don't tell people, they won't, I don't know, they won't think you're marriage material, you know, like it's really done a lot of harm, certainly more harm than good to our society, you know, to women like yourself. And so, you know, that's such an important point to bring up. I always talk about knowing your family history, and particularly, you know, something I tried to talk about in the summit too, is I know South Asians just don't talk about family history enough. And the other point you bring up is, you know, some kind of reproductive cancer. That's very common in, you know, a couple generations ago, not really even knowing. Truthfully, the doctors weren't even sharing. They were like, they are not going to understand. They're lay people. They don't need to know. Like, and of course that did a huge disservice to women across the world. But most notably, you know, any history of ovarian cancer is a knee jerk for genetic testing. And so, so that's the huge disservice that they did, is there are so many women who could have been getting genetic testing that just weren't. And I still see that today in so many of my patients. And so, so that's a really good point that you brought up. And I definitely want to loop in Dr. Jhambekar at some point, but we'll let you finish your story about what you just went through.
I mean, I think the other big point is also 15 years, 16, 17 years ago, genetic testing wasn't what it is today. And they've made so many advancements. So if you're in your 30s or 40s and your mom had cancer and she was negative at that time, it doesn't mean that you shouldn't get retested today.
I actually
even in 5 years, actually, they're recommending retesting at this point if your genetic testing is older than 5 years.
Oh, wow.
Absolutely.
Okay.
And I tell all my patients that too. And I'm sure you do as well, counsel them on that need. And some of them, they retest the sample themselves, Amani, or you ask your patients to fully submit a new sample.
They'll submit a new sample. They'll retest it if they're reclassifying a VUS, but in terms of like doing a full panel, they'll do a whole new sample because there's a lot of things that we're catching now that we didn't catch 5 years ago. And the other issue is that in populations like ours, we're kind of underrepresented in genetic testing samples because most of those studies and human genome research has been conducted on Caucasian patients. And so our population, those who are Latinx, Black, like we're really underrepresented. So to catch a genetic mutation in a minority population is actually somewhat challenging to do because of that. We do catch a lot of VUS, but we just aren't testing enough to reclassify them yet.
And to clarify, VUS means a variant of undetermined significance. That just means that they can tell that something's not quite right, but they don't know if it's clinically significant and going to lead to breast cancer or ovarian cancer or colon cancer, whatever the particular concern is, versus what Dr. Malhotra has, for example, which is a known mutation. You know, we know that it's one that has an almost 100% penetrance and chance for the development of breast cancer. So, so all good points. You know, talk about your family history. Stop keeping secrets. You know, just really try to be open with your family and ask those important questions. Talk to their doctors, etc. Number two, like we're talking about genetic testing. Typically, the American College of Radiology recommends that all women, no matter your family history, before the age of 30, have a discussion of your personal risk to determine your need for early screening, or if you're someone who will start standard screening at 40. And then you want to be able to identify as early as possible if you are someone that needs genetic testing, because like she said, it could determine, you know, whether you need to start family planning, whether you need to talk about oncofertility, which is fertility preservation for those women who might have cancer or who have the BRCA gene. And another one of our physicians in SAWAS who did the summit and did a couple of recent talks, Dr. Anita Patel, her husband had the BRCA1, has the BRCA1 mutation that was detected after his sister developed breast and ovarian cancer. So they did IVF for the purposes of screening their embryos to screen out those who were BRCA positive. And she's very open about this. That's her entire, not entire Instagram, but it's open on her Instagram. She's talked about it before. So we're all just trying to get this information out to you on, why we're even having these conversations. It can impact so much. It's not just about the pink ribbons and the, awareness. This is like actual action that we want all of you to be taking. So, Simran, how about we come back to you, and then we'll tie it in with Amani on talking about some of the surgical options. So Reema, you mentioned your sister had breast cancer, and that's why you started your page a couple years ago, and that your cancer was detected on screening. Were you getting high risk screening because of your sister's diagnosis?
So no. So my sister was diagnosed in 2016, and she was 37, 38 at that time. And then I had just finished my fellowship. I was still in New York when we found out. And when I had already had my first son, and we were planning to have my second one, so I spoke to like my GYN and OB, and she was like, yeah, you don't need your mammogram right now. My sister is 3 years older than me. So I was like, okay. So, and I never had any symptoms, and that was it. And then after I had my second son, and then when I went for a follow-up with my GYN, and she was like, now that you're done breastfeeding, maybe you should consider getting a mammogram. Like, she did the breast exam, and I used to do them too. I never felt anything. So then I was like, I tell my patients to get a screening colonoscopy, so I should probably go ahead. And the other thing was that I had didn't think much of getting a screening mammogram, because not a year, but like 6 months prior to getting diagnosed, I had done myriad genetic testing on myself because of my father also having colon cancer, and when my sister had breast cancer, just to rule out BRCA, any genetic disorders, and which came back negative. So I'm like, I'm fine, obviously the initial thoughts, and I never felt anything. But then when I went for the screening mammogram, they called me and they were like, by the way, we think we saw some calcifications. We need you to come back and get an ultrasound. We're like, okay. And they're like, it's not a big deal. This happens a lot of times. Okay.
Right.
Then when I went, then at that time, the radiologist was like, it looks very suspicious for cancer. I would suggest you setting up the biopsy sooner rather than later. And at that time, it was like holiday season. I think it was like Thanksgiving coming around the corner, and we had planned our trip to Dallas for the Pinnacle conference.
Yeah.
And also because my in-laws, my husband, he's from Dallas, and we were in the middle of moving to Dallas, which was supposed to be this year in March. And my husband had given his resignation letter and everything, that he was going to stop working in February, and I was trying to apply for jobs over there, and we were looking for houses and everything. So then I got the biopsy the day before Thanksgiving, and the radiologist was like, it may take up to 10 days actually, because of the holiday coming up in between. So he was like, go on your trip and I will just give you a call when I hear something. I was like, okay. And then we were driving to the airport, and it was a Black Friday, and I got a call from the radiologist actually 2 days later rather than a week later, and he was like, oh, by the way, it is invasive ductal cancer, and it has metastasized to your lymph nodes, because they did lymph node biopsy, and there were 2 lesions. Actually, it was on my left breast. And then we were like, okay, there's no way we could go to Dallas knowing that we have to start following up, because he was like, you need to talk to the breast surgeon as soon as possible. And this was like Friday evening at 5 p.m. And then, so then we call a couple of our friends who were surgeons, and then we're like, okay, we need an appointment Monday morning. We canceled our trip, and we, so that started the whole, but yeah, definitely, like, you know, screening is so important. Like, even though I had the genetic testing, I could have probably put it off another year or so, just thinking, oh, I don't need it, especially because we were in the middle of moving, you know? And then that's why we decided to postpone our move to Dallas too, because I started my chemotherapy right away. And we were like, if we move now, we don't know when the insurance would kick in and everything, you know, the rapport that I had with my oncologist and as well as the surgeon. So it was definitely something, because we never had any other family history of breast cancer, because my grandmother, she's 96 years old, she's fine. My mom is fine. My maternal aunts, they're all been okay. I have 6 older sisters.
Oh,
None
wow.
of them had it except for my sister Aisha, who's immediately older than me. But so just one of those, I don't know.
I remember when you were, you know, initially diagnosed last year, and yeah, Pinnacle week, you missing Pinnacle weekend, and you bring up a lot of great points too, kind of tying back to what we talked about already, that, you know, your genetics being negative, it's possible that, you know, I mean, I hope that you don't have a genetic mutation, but it's possible that they just haven't identified what it is that you or your sister or, you know, or your dad might have had. And a couple of other points. Yeah, you know, breast cancer, going through the treatment, as we'll touch on later, certainly can be a really disruptive time in women's lives and families' lives, and everyone that's going through it. And obviously, the pandemic threw a wrench that no one could have expected as well. And so, you know, I actually always tell my patients 2 things. Number one, I tell them, and Amani, you can speak to this too. I always tell them to get the care that they are most comfortable with, that's going to be the most convenient for them, because there are so many appointments that you're going to have to go to, and so many doctors and counselors, and I don't know, at some point you're seeing navigators and nurses, and so, I mean, I see a lot of nodding heads. So hopefully you on YouTube can see that as well, that, you know, there's this rush or this desire to think that you know, I want to go to, I'm not going to name them, but I want to go to cancer hospital number 1 or cancer hospital number 2. And there is no denying that those hospitals are amazing and that the care that they give is amazing. But those are also often the institutions where people with super rare, untreatable, metastatic, et cetera, processes go to. But, you know, breast cancer is something that unfortunately is very common, but fortunately means that the care of breast cancer is something that a fellowship trained surgeon, or, you know, radiologist or radiation oncologist, they're going to, you know, all come together and make a plan that's just for you. And so that's my husband. He knew that this was happening, so that's on him.
But you're right, Anjali. I know what you're saying, because when I got diagnosed, because now that we're in Allentown, Pennsylvania, everybody was like, you should go to Sloan Kettering. What are you doing?
Right.
And then when I spoke to a lot of my oncologist friends all over the country, they were like, breast cancer, like you said, is so common. That is the standard of care everywhere.
Right.
They were like, luckily you don't have a rare form of cancer, so it's not like you have to go. They were like, if it makes you feel better, if you want to go.
Right.
But then when I remember sitting down with my husband, we're like, what to do? We're like, no, we're just stay close to where we are because of the kids. I'm like, I don't want to be away from them already, you know, because they're too young to understand what's going on.
And what kind of cancer was it? I know we talked about it before. Was it
were you hormone
was it
positive?
I'm triple positive. Yeah. So
they gave you, so the chemo they gave you was TCHP?
Yeah.
Yeah, so that's exactly what you're saying. Like, it's a standard of care.
Right.
Like, had you gone to MSK or, I mean, Memorial Sloan Kettering or MD Anderson here in Houston or been treated there, like you would have gotten Taxol, Carbo, Herceptin, and Perjeta, which is kind of, you know, evidence-based as the best chemotherapy regimen. And they would have given you the same medications to make sure that they looked out for your white blood cell count. They would have checked your labs the same way to make sure you were fine before giving you the next dose. So I definitely agree with you, Anjali, that breast cancer is super common and we know how to beat it. We know how to beat it everywhere. And that's actually why I chose this field, was because it's such an evidence-based field. And we have national standards that we can follow. So I think that it's certainly a good idea to get a second opinion or third opinion or fourth opinion if that's what makes you comfortable. But ultimately, where you decide to get your chemo specifically, it should be what's convenient for your life, because you're going to have to go and sit in an infusion suite for 5 or 6 hours every 2 weeks and then every week at some point.
Right.
So I couldn't agree more with that particular point.
Yeah. And, you know, again, this is for, you know, premenopausal breast cancer, not just for the aunties. This is, you know, young women are getting this disease who, you know, like Roshni, you know, might have been in school or grad school or just starting a new job. Like Reema have 2 young kids and, or 3 young kids. Yeah. You know, and your own job and your husband's busy schedule. And, you know, like we all have things going on. And, you know, again, there are going to be people who are going to need to go to those centers, but for the, you know, average breast cancer, they're being treated evidence-based. You know, if you are going to a reputable facility, there are cancer, you know, tumor boards is what we call them, right? Where your case is being discussed. Precision medicine, evidence-based medicine tailored to you is happening. The other thing, you know, even though we're saying like, oh, there's this standard of care and everybody, you know, can get the same thing everywhere, cancer care is not one size fits all. So, you know, I know this is the day and age of the like Facebook community group and the like whatever other groups, those groups for any
Reddit, yeah. WhatsApp is a big one.
Yeah, exactly. And so you're going to see like, well, my doctor said this and I got this and I got that and I did this. And that's great. That's because that's what worked for you.
And all breast cancers are different too. Like,
right.
Yours is triple positive, but not everyone's is. That's an uncommon one. That's only about 15% of breast cancers overall. Right. So everyone, like based on that factor and what the stage is going to be treated slightly differently. If we know what the stage is and we know what those factors are in terms of the receptor status, then the standard of care is going to be pretty much the same. But what happens when you're reading on these forums, and I have patients every day who come and tell me like, well, I heard on Facebook that this is what I should get. Right. It's not, sometimes they're not matching into groups that are exactly people who have exactly the same kind of disease that they do. Right. That being said, I do have a patient who was in a triple negative Facebook group. And I didn't know Facebook had a triple negative breast cancer group, but I was very impressed by that. And she's actually getting a lot of interesting information that's very relevant to her care based on that specific group. And so it certainly can be a good resource as well, as long as you really understand the subtype of cancer you have and can be with people who have similar types.
Yeah, exactly. Grain of salt. I mean, as with all of the internet, right? Like unless you're using an actual known entity, it's always with a grain of salt. So we're talking about, you know, triple positive, triple negatives. So just a moment of clarification, and then I want to move on to Roshni. So Reema's cancer, as she referenced, was triple positive. And what that means is it was estrogen, progesterone, and HER2 positive. That means that her cancer cell had these little receptors on them, and they were all being potentiated or increased by estrogen, progesterone, and HER2. So that affects the kind of treatment that Reema would get. And it's also why when you hear about breast cancer, or if you listened to my talk at the summit, which I think is going to be released on our YouTube this month, I talked about how hormone exposure is a risk for the development of breast cancer. That's our own natural hormones. So for women who started menarche early, who go into late menopause, who are on hormone replacement therapy, or who have increased circulating estrogen due to obesity, because our fat cells secrete estrogen. Those are all ways that we can increase our risk for the development of breast cancer. However, when it comes to premenopausal breast cancer, it is very often seen as triple negative breast cancer. And Roshni, I know you can tell us your experience with that, but triple negative means basically the exact opposite of what Reema had. So that's where their cancers are not sensitive to any of those. And those cancers can, in addition to often affecting young women, they can present at a large stage. They tend to grow quickly and can be more aggressive. And so Roshni, that's a pivot to you. So 22 at the time of diagnosis, I mean, first of all, like, how did you even know? Were you doing self-exams at that point? Like, how did you identify it? And like, was breast cancer even on your mind?
No. So I felt a lump myself. But, I was 22. I just, asked my friends. I was like, hey, there's a lump, like, and like they felt it, and they're like, oh, like, women have lumpy breasts. So I'm like, okay. And like, there's no history or significant history of breast cancer in my family. And I tested negative for the gene. This was after I was diagnosed. So, I think I found in like February of 2019, and then April of 2019, I had pain in my armpit. I had bruising on my left arm. I then had like bloody discharge coming from my left breast, and that's what made me like go to the doctor, because like, okay, like there's something wrong. Like I need to like do something about it. And Anjali, when you brought up the point, like, it does matter like who your doctors are, because the doctor, you're going to see them all the time. Like, I'm going to see my oncologist tomorrow.
Yeah.
Like they become like your friends, basically. Like they're in your life for the rest of your life. So when I initially went for my symptoms, I went to a doctor I found on ZocDoc, very random, because I didn't have a primary care doctor yet, because I just moved to New York. So I found her on ZocDoc, and she was Indian. So I was like, okay, like I felt comfortable because she was Indian. So I went to her, and, I told her everything. She asked me the generic questions, like, do you have family history? When did you feel it? And I told her everything. And, I was like freaking out. And then she felt like the breast, and she saw the blood come out, and, she was just like, oh, there's like really blood coming out. And I was like, yeah, like it's not like a joke. Like there's actually something happening. I need to know what's going on. And she really pushed back on me getting additional testing. She was trying to like I think she wasn't thinking like the worst possible outcome, which in turn like could have had me not get additional testing, like not get a biopsy, because of she was considering my age, and she was considering that I had no family history. And so I got a sonogram, and, the sonographer was like looking at it, and I'm looking at it, and I have no idea what I'm looking at. So I'm asking her, what's going on? She's like, I can't tell you. And I was like, okay. And then I go back to the OBGYN, and, she's like, oh, they're recommending that you go get a biopsy. So it's like, okay. So I lived in New York, so I was like, okay, like I'll go get a biopsy, thinking that it would be easy. But it was the weekend, so there was no biopsies available. So I was like urging her to get me one as soon as possible. And, she was like, well, you waited long enough, like you can wait longer. And I got mad, and I am not the type of person to, be aggressive, or, I'm very like nice, and I respect people, but I knew that this was my health, and I needed to like figure out what was happening in order to do something about it. So I pushed her. I was like, no, like you're gonna get me a biopsy like this week, or like I need it, and I need you to listen to me. And she finally did. It was like, it felt like days were going by, but it was like one day of all of this. And so I went to get a biopsy that following Wednesday, and I didn't know what a needle biopsy consisted of. So I got into the room, and, they stuck the needle in my left breast. And then they also took samples from my armpit. and they ended up taking 3 samples. So I can only feel 1 lump, but they took 3 samples of 3 lumps. And then that following Friday, the OB/GYN called me. I was gonna go in by myself because I was in denial. But my cousin came with me and my friend, and so we went, and this doctor didn't, had no idea how to tell me at 22 that I was gonna be diagnosed with breast cancer. And to me, that was frustrating because she didn't believe me, and that could have prevented me from getting care, when I needed it. And I was triple negative, and it's aggressive. So if I listened to her and I waited longer, I could have been diagnosed later on. I was initially diagnosed with late stage 2, early stage 3, because it progressed to my lymph nodes. But yeah, it's very important to have medical professionals who believe you and, take into consideration your needs, because yes, like cancer care can be the same everywhere, but it also has to tailor to the person. Like I am 22, well, now I'm 24, but I'm in my 20s and I want to have kids later on. And so when I went to go meet my medical team at Mount Sinai, that's what they thought about. They're like, okay, like, we know your age and we don't want you to, because you're going through this now at a young age, have to deal with this later on in your life. Like, because you have to deal with it now, we only want it to happen to you now.
Right.
So they gave me time to freeze my eggs, which I had no idea that was like part of the process before I started chemo. And it was very like quick, like turnaround. Like you said, Reema, like, you got your phone call and then it's like, you're put into like fight or flight mode of like figuring out your appointments, who your doctor is going to be, who's going to do this for you, who's going to do that for you. And it's a very like whirlwind experience when you're first diagnosed. And it's a different type of experience when you're in your early 20s, you just started off in your career and you don't really have a medical background.
Yeah, I can only imagine how, I know you and I have talked about this before, so it's not my first time hearing this story, but it's still, I can only imagine. And some of the points that you brought up that I want to hit on and that I'm sure Dr. Jhambekar see all the time. So absolutely, never discount any patient's symptoms. That doesn't mean that they are always cancer. And in fact, majority of the time they are not cancer. So your doctor thinking it wasn't cancer wasn't necessarily wrong. Your doctor not acknowledging that you had a symptom that needed to be worked up is the problem.
Mm-hmm.
So to all the young ladies, young women out there listening, yes, you want to get imaging for something that you're feeling that you and your doctor are worried about, but that doesn't mean it's going to be cancer. And that for me, that's the biggest problem that I have, or the battle that I have to fight, where I, go in and I do the ultrasound and I tell them everything looks fine. And instead of being relieved, they say, but I'm feeling something. And our breasts are active, they're alive, and they're constantly changing with our hormones. And so our normal tissue can oftentimes simulate or mimic a mass. And so
let me just jump into,
sure.
So thank you so much for sharing that to all of you, Reema and Simran and Roshni. I really have learned a lot just from hearing your stories today. I will say your story, Roshni, is 100% of what I see in young women, even in women under 40. I've had seen patients diagnosed in their teens, unfortunately, with breast cancer. And 100% of those cases are, they felt a lump, they told one of their primary care doctors or an OB/GYN about it. They said, oh, you have a 1.9% chance of having breast cancer at this age. So it's definitely not breast cancer. The lump didn't go away. It got worse. It got harder. It got more painful. The armpit started to have pain.
Mm-hmm.
So they had to advocate for themselves and say, listen, like, this is not okay. I know my body and something is not right. And I understand the alternate standpoint that, they feel something and it might not, most of the time it's not something that you're saying, Anjali, but
it always needs to be worked up. It always
it definitely needs to be worked up.
Yeah.
That's what it is. I agree with you 100%. It's like, no one, I always say this, no one has mammogram eyes. I don't have mammogram eyes either. I would love to have mammogram eyes. That would be an awesome
X-ray vision.
superpower for
I
a
have
breast,
X-ray
for a
vision.
breast
Thank
surgeon,
you.
surgical oncologist to have. That would be amazing. But like even my physical exams, and all I do is examine cancers all day, every day, is not enough to replace a mammogram and an ultrasound and potentially an MRI, depending on if it's indicated then. And like, so that's really, I agree with you totally, Roshni. And I like that you're giving this message to all the young women. If you feel something and someone's not taking you seriously, take it to someone else or make them hear you, because it is your health, take charge of your health. Yeah. Statistics only matter for, like, when it comes down to one person, you either don't have breast cancer or you do have breast cancer, right? It doesn't matter if 1.9% of women your age have it, because for you either do or don't.
Right.
So I definitely agree with you. Advocate for yourself. If you feel something, make someone hear you. And us doctors, like, we're used to hearing a lot of things from patients. And sometimes, we're not as good listeners, honestly, as we should be. And I'll admit, sometimes I'm not as good of a listener either, but I think it's important for every single woman to advocate for herself and be like, listen, I know my body, something's going on here. I need you to get some imaging. And I tell women in my circle all the time, when they come to me with this complaint, make them order imaging, because they don't have mammogram eyes. They don't have mammogram hands. They can't figure it out just from examining you.
Yeah, absolutely. Gosh, we're already, it's already 8:15. So let's keep moving along. But yes, so I think the point of that, absolutely. If you feel something, say something, get it worked up. If you feel something, it won't always be breast cancer. But again, we need to figure out whether it is or not. And the last thing, and I'm sure Amani has read this on reports, I've said it in endless reports. If you feel something and the imaging is negative, that's not the same as saying you don't have anything. And if the area worsens for you, bring it up to your doctor again. So sometimes, the breasts are always changing. So just the mid-cycle monthly exam is so important. And if the area that you're concerned about continues to be of concern and is changing, go back to your doctor so that they can address it. To the oncofertility and preservation, Roshni, that you mentioned. So absolutely. And, there are so many great fertility providers. We had some at our Southwest Summit. We, so many that are on Instagram, thankfully sharing information with women on how they can take charge of their fertility, or for women like yourself who find themselves in that situation. We're so lucky to have those options to be able to preserve fertility. Or even for someone like Simran, right? Had you, not already had your wonderful husband, who, by the way, you guys should totally catch that video of him singing to her at her wedding. It's on Instagram. But I had actually seen it way before I ever knew Simran. That's how much of an internet sensation that video is. So I had seen it like years ago when they got married. So, but had you not, had that plan in place, because some women don't, right? Some women get a BRCA diagnosis and are nowhere near being ready to family plan, and that's okay. You can be a Previvor and say things, do IVF, and get to that when it needs to happen. So we're all Zooming, which is what everyone does all day, every day because of the pandemic. So Reema, tell us, in a few words, how the pandemic affected you being, in the midst of your breast cancer care.
Yes. So when I obviously had neoadjuvant chemo prior to having surgery, so I started with a lot of support group, because I have a big family, and so my sisters were coming with me, or my husband, depending on the work week. So I always had 1 to 2 visitors with me. And then when the whole lockdown happened, I remember when they were confirming my appointment, they were like, oh, by the way, no more visitors are allowed. So that was like, okay. So, and that took a lot of emotional toll on me, because then I had to like do everything, like driving myself there too, because and before I was able to like valet and stuff, they took everything away at that time.
Oh, wow. Yeah.
It was like March. So it was definitely something that I had to do on my own, and then leaving the kids behind. And so it was like a lot of emotion, because they would be like, where are you going? Why can't we come with you? Especially my younger one. And and then I had surgery. Thankfully, they allowed my husband to come with me there when I had my surgery in April after the chemo, and he was allowed to accompany me for the outpatient. And that thing, at that time, I spoke to Amani about it, because I was like afraid. I was like, oh my God, do I really, because of the whole elective procedures being canceled. I remember talking to her. I was like, if this is an elective procedure, do you think I could just wait till after?
Right.
Like, not really.
Right.
So, but yeah, thankfully the surgery went uneventful. I had a great experience with my breast surgeon. He was really phenomenal. Like, the healing went well. And then a month later, I started my radiation. So, and that was every single day, 5 days a week. And that was another thing, no visitors allowed. So definitely, just, like, it was something that, even as a physician, I, telling patients, oh yeah, it'll be all right, but living through it, you're like, wow, this is harder than expected. But yeah, I'm just glad that things went well, and I was able, and that was the other reason I'm glad I did not go to like Sloan Kettering or anywhere, because the cancer center was literally down the street from where I live. It was like 5-minute drive. So even when I went alone, it wasn't like, oh, I was driving for hours to get to that place. So definitely.
Yeah, and I'm so glad that you were able to get your care, and you certainly referenced something that I know Amani dealt a lot with. I dealt a lot with. We, every major breast imaging facility in the country stopped screening mammograms on March 17th, stopped diagnostic mammograms, which are those performed for symptomatic women or women who have a mammographic abnormality, and stopped those shortly thereafter. And it was really difficult for everybody, for the patients that we knew had cancer, for the patients we were concerned who had cancer. Obviously, the initial goal was to try to, of course, minimize exposure, minimize utilization of resources, so that they could be, funneled towards the true front lines. But at no point was this about, a disservice to those that we knew who had cancer. But unfortunately, some of that message has perpetuated, and this concept of non-essential care, we know the statistics have been out since like May, that 80,000 cancers of all types are going to be missed because of the pandemic. 35,000 breast cancers are going to be missed, and there could be thousands of women who go on to die because of those missed breast cancers. So Amani, can you quickly hit on, are you guys back to business as normal when it comes to breast cancer care?
For us, no. It's we did reopen in like mid-May to restart doing screening mammographies, but I think the message had just been sent out to women, that like this is being shut down, this is not essential, this whole non-essential care concept you hit on so beautifully, that it's really taken a while. Even now in October, we're just now starting to see like our screening mammogram numbers catch up to what they were in February, which is surprising because October is usually a huge month for screening mammograms. And as a result, I am seeing a lot of patients who have felt masses since prior to the pandemic, and unfortunately didn't come in to get mammograms until like late September, and are now getting biopsies. And some of these cancers are a little bit faster growing. And it would have been nice to catch them, in the beginning, back in March when that first started happening. That would have made someone present at a lower stage than they are now. And so I definitely agree with your point there, that if you need to get a mammogram and you pushed it off because you're worried about, safety measures, you're worried that, it's really just not worth it with the cases that are happening around you in your county, in your city, I think most imaging centers are doing a pretty good job of spacing apart appointments, of really cleaning the machines, of having the staff all wear masks. I think it's really important because if that gets missed, then that's really an opportunity that gets missed, unfortunately. And we really want to do everything we can, catch it as early as we can, and help you kick this into the rearview mirror, you know?
Exactly. And the thing is too, because of all the sanitizing and social distancing, and safety measures, it means that centers are not even capable of doing the large volumes that they were. I mean, we used to, like you referenced, crank and burn in October. We were just doing screening mammograms late, early, on the weekends, all the things. And we are still doing that, but it's just not to the same level because the sanitizing, takes time and the distancing, et cetera. And so basically, long story long, it means that it's going to take even longer to catch up. And so if you are a woman who needs a screening mammogram, if you are a woman who has a symptom, the time is now. And the other thing, for you moms out there, I know you've got Zoom school and you've got, normal life also. And the pandemic has not made, the lives of parents and moms any easier. But the whole, put your oxygen mask on first. I'm sure Reema as a mother can speak to that. I'm sure Simran as a mother can speak to that. You've got to go get your mammograms. I don't know how, you can make that happen for you, but pull your, tribe together and village and make it happen because we are, Amani and I are waiting to take care of you. Well, hopefully Amani doesn't have to take care of you. Maybe you just stick to me. Okay, so I do want to then, Simran, come back to you and quickly hear, tell us a little bit then about the decisions that you made this year.
Yeah, so in January, I had my last screening MRI, and then we started meeting with doctors. To Roshni's point, my first set of doctors didn't listen to anything I was saying, and I'm a doctor. I understand the language, I understand the system, and so I wasn't immune to it whatsoever. I walked out of 2 different doctors' offices in tears because it just literally were not listening, and I felt like I was just written off for what I wanted for my body. And it wasn't what they thought was the right thing. So I finally did find a set of doctors that I loved and they were amazing. And so then it was just all the decisions of like mastectomy and hysterectomy and when to do everything. And so my husband's a critical care doctor. I'm a palliative care doctor. All our family's in Canada. So for us, I wanted to minimize surgeries. So we decided to do everything together. And so it was scheduled for June and then COVID happened. So then that got canceled. My husband moved out and, all of that stuff happened and it got rescheduled for the fall. So today I'm 5 weeks post-op from my surgery. So I had a bilateral mastectomy without reconstruction and aesthetic flat closure and a total hysterectomy with removal of my ovaries and tubes as well. And to Reema's point, I was alone. He dropped me off at 5:30 in the morning and I did the whole thing alone. And it was the most, I'm shaking thinking about it because it was the most traumatizing experience. And I'm a doctor. I knew everything that they were doing. But, it was so scary because the first day I was totally out of it. So I had no idea who was giving me what or doing what. And then the next morning, unfortunately, I had a complication and I developed bilateral hematomas. And by the time I saw the doctor, they were wheeling me back to the OR. So I couldn't even tell my family what was happening. I didn't know if my husband knew what was happening. And so it was crazy. And luckily everything worked out fine. My nurse was phenomenal and she vouched for my husband to come in. So he did after my emergency surgery, but I got my drains out on day 9. And since then it's been pretty smooth sailing. But yeah, the patient experience piece of it. And, I vouch for my patients. I mean, I spend like hours on family meetings. And so I like to think that I listen and I hear a lot because that's what I do for a living, but nothing could have prepared me for what I saw and experienced. Like being alone in the hospital is terrifying. And, so I can only imagine for my patients who are dying in the hospital alone, what that must be like for their families and for them. So the whole perspective just changed. So, but, my surgeries are done, and so I'm on the other side. I felt really blessed. My pathology was all negative. And so yeah, now I'm just kind of using my platforms to spread the word. And I think since I started sharing my journey, I've had like 3 or 4 South Asian women my age who have reached out, who are in a similar situation to me, where they have the mutation but don't know what to do next. And I hear the same thing over and over again. I thought I was the only one. Like, I can't find anyone who's Indian who has this mutation, who's, so I feel like I'm lucky that I've found this community and that I can use my experience to help people. And obviously what Roshni and Reema are sharing their stories is so powerful.
Yeah, no, and it is hearing both you and Reema's stories about going through it alone. Roshni, I can only imagine 22, not in medicine, what that was like, but to know that also people who fully have seen it, have done it, have been educated on it, to also have that just sort of, again, puts a human face to all of this. And I can't imagine going through all that alone. A couple of the things you said, Simran. So again, the South Asian community just not necessarily traditionally being as supportive and open is obviously a huge problem. I can't even imagine what aunties, if they heard double mastectomy at the age of, in your 30s, like, I don't even want to hear the comments.
And no reconstruction. It's like,
right.
Yeah. What do you mean you're not, what?
Yeah. So, yeah, I can only imagine.
Personal decision though.
Right.
Very personal.
And the fact that you had like the bilateral hematomas and had to go back, like had you had reconstruction, that would have been a huge problem.
Right.
And it's something you can always change your mind about or make other decisions in the future when you have more time to process. The surgery you had was big enough as it is. So, but I can imagine everyone judging and being like, well,
Right.
Yeah. No, it's totally personal. And for me, when you hear why I made that decision, because when you're doing this for prevention, it's very different than when you get a diagnosis. And I went through it with my mom the second time, obviously, when 3 years ago I was really understanding everything that was going on, and it was just like go, like we got a date and we just chose a reconstruction route and we went with it. But like for me, the last 5 years between screening and thinking, it's just been like, do I do this or do I do that? And then within each option, there's like more options. And so for me, I was kind of like, I always just knew that the mutation was a blessing in disguise. So it wasn't like, if I'm going to get the surgeries, but when. And then when it came to reconstruction, it was like, I'm 32A, I hardly have any boobs left after breastfeeding, right? And they did what they were supposed to for me, and they're never going to feel the same with reconstruction for me. So it just was like, this is what feels right? And if it feels right for you, then that's the right decision.
Yeah.
So.
And in terms of being alone, I mean, hopefully that's what things like this and the advocacy that you're doing now help eliminate. But also there are great groups. The Breasties is a really good one. Paige, her Instagram handle is at Paige_Previvor. She started a community called the Breasties, and it's a really great resource for women who have to make these decisions. There's also Previvor, that's from Allie Rosen. Oh gosh, I'll have to verify that. But she's also a Previvor. I think she was like a former Miss America or Miss Maryland or something along those lines. And I work with Bright Pink, and of course they're always aiming to educate and empower women on their breast and ovarian cancer risk, and of course have a large number of Previvors in the community. But there are resources. There are women like that. Absolutely.
Well, I mean, as you all know, like being in the breast cancer community, it feels like it's very one-sided. The story is always like, the person is Caucasian and, we don't fit into that storyline. So I found For the Breast of Us, which is Jasmine and I'm forgetting
Marissa.
Marissa. Yeah. They started For the Breast of Us for women in the BIPOC community. And I really liked joining that community because, for radiation specifically, our skin tone is darker, and in the packet that they give you, it says you're gonna just have a sunburn. I've never had a sunburn. And so after like week 2 of radiation, my skin started turning black and it looked disgusting. Like it looked like Reema's shirt. That's how black it was. And it started peeling, and my radiation oncologist was like, oh my God, like, he was like, wow, you're having a really bad reaction to this. And I thought, oh my God, like what is happening? And then like 2 months after I ended radiation, I found For the Breath of Us, and I started talking to Jasmine, and we had the same experience. And I was like, oh my gosh, like, why didn't I think of that? Like, I was asking my friends who were white about how their skin reacted to radiation. I wasn't asking women who were my skin tone what happened to their skin with radiation. So it's really important to connect with women of the same background, of the same race, because we're gonna experience different things. Like to a certain extent, people won't understand the auntie stigma, like the aunties that stigmatize cancer and that stigmatize, that have commented on your surgery, Simran. So yeah, just the point is, it's really important to find people of your background.
No, that's a wonderful point, and thank you for bringing that point up, and also that group, who's a great resource. Yeah, no, and I mean, just hearing from the three of you, again, Amani and I do this every day, but every story is so different, every experience is so different, and then, yeah, I mean, representation matters. I think, I hope 2020 has taught everybody that, but certainly just from that issue that I do this every day, and I don't think that I would have even thought of that. So thank you for pointing that out for me. With us being premenopausal women, of course, that means that we have hormones in our body, and a lot of the medicines that are involved in breast cancer care work to counteract that. Or in Simran's case, your ovaries have been removed. So can each of you we'll start with one and then go to the next, tell us a little bit about that. So Simran, are you on, or are you planning to take, or if you want to share, hormone replacement?
Yeah, so that was kind of one of my biggest fears about the hysterectomy and oophorectomy. But when I spoke to my gynonc, they've come out with quite good research now in BRCA positive premenopausal women who are going for preventative surgery, that hormone replacement actually has much more benefit than risk, especially since I was getting a bilateral mastectomy. So that's part of the reason. And I know this is still kind of controversial as to, do you take the uterus out? Do you keep the uterus? But the reason I was done having kids, the reason I chose to take my uterus out was so that I could be on an estrogen only transdermal patch.
Right.
And so far, I mean, I'm 5 weeks out and I feel exactly like myself. I anticipated a lot of things, but I feel great. I saw my GYN onc yesterday and everything looks good. So I'm happy with that decision so far.
Okay, great. Yeah.
That's
And
amazing.
yeah, no, that is. And I think that was really pivotal for women, because obviously just hearing that you're going to, lose your ovaries in your 30s, it's not a not easy pill to swallow. So,
No, yeah.
And so, Reema and Amani, I know you referred to your chemo course. Are you also on tamoxifen then, which is something that works against the estrogen receptors?
So right now, after radiation, I'm still getting my Herceptin Perjeta, which I'll get till the end of the year to complete the cycle. And I've been started on tamoxifen also. So I actually had a hysterectomy when I had my second son, because it was a traumatic, I had a post, hemorrhaging and everything. So he was, because they wanted to talk to me about oh, do you want to go?
Endometrial hyperplasia, yeah.
Yeah, exactly. So that took care of that part.
Right.
But the side effects of tamoxifen, they're definitely real, and they are very, very, especially, I would say the hot flashes and like the mood swings times, but the hot flashes, I would say, definitely, especially in the middle of the night where I'm like, why can't I sleep? I'm like sweating like a pig. And so, but I have to be on it, he said, for 5 years.
At least
At least.
5 to 10 years.
Yeah, exactly. Yeah.
Yeah.
So for y'all, tamoxifen blocks estrogen, and because it blocks estrogen, which is, as Anjali stated, a hormone we all have because we're premenopausal women, it causes menopausal symptoms like hot flashes, like joint aches, and it can also cause, it has a rare side effect of endometrial cancer because it can cause endometrial lining to build up. But if you don't have a uterus, then it's not really a problem.
Right. Exactly. So now, Roshni, obviously your cancer was not sensitive to hormones. So you went through surgery, chemotherapy, and radiation. Is there a long-term, like you're getting high-risk screening? Is there anything else that you're doing?
Yeah, so I did chemo first because they wanted to shrink the lumps. And so by the time I was done with chemo, there were no lumps, like they were gone.
Wow.
Yeah.
Yeah.
I think
Congratulations.
my oncologist, thank you. Yeah, I thank my oncologist a lot and my surgeon. They had a plan for me, and they're like, after my 3rd chemo treatment, my oncologist said to me, she was like, oh, it's like they're getting smaller, and I'm putting it out there that there will be no cancer cells left. And I was like, okay. And then when it happened, I was like, oh wow, so I did chemo, and then when I did surgery, my surgeon let me choose what I wanted to do. So since I didn't test positive for the BRCA1 or BRCA2 gene, I decided to do a lumpectomy, just because I'm young, and I didn't have the mental capacity to understand a bilateral mastectomy, and I don't think I could have at that time. So that was the right thing for me. But yeah, so then I had to do radiation. So yes, I'm doing every 3 months seeing my oncologist. I just had my mammogram last month, and that was clear. And then I'll do scans later this year. I was supposed to do all of this earlier this year, but everything was pushed back because of COVID. But yeah, so my plan is see my oncologist for every 3 months, and then do my MRI again.
Great. Well, that's awesome. Yay for clear mammogram. And Simran referenced it earlier. Reema's mentioned it. You've mentioned it. So high risk screening is for, again, women who are of high risk, which doesn't have to be just women with a genetic mutation. So if you have family history of premenopausal breast cancer, so that's traditionally considered any cancer before 50, even though some women go into menopause in their 40s or some go later. We just cut it off at 50. So premenopausal breast cancer, family history of young triple negative breast cancer, and family history of ovarian cancer. Those 3 things you definitely want to be extra sure to have those conversations with your doctor before the age of 30 to establish what your screening protocol is. And again, it's going to be your screening protocol. It's not what your friend is getting. It's not what your friend's mom is getting. It's what you need. And MRI is part of that. It is the most sensitive screening tool that we have. Mammogram is the tool for everybody. Ultrasound is the tool for some. MRI is the tool for some. But all of those go in conjunction with mammograms. So I think we've reached the end of some of the things that I had on the docket. Is there anything that you guys want to discuss that you can think of that you want our listeners to know about?
Yeah, I wanted to add, since I'm not in the medical field, what I brought to every chemo appointment and every appointment with my oncologist is my notebook. And I wrote down, literally after my first chemo treatment, I wrote down how I felt every day until my next treatment. And I was having really bad headaches and very forgetful. And I had no idea that chemo brain was a thing. I thought I was making that up in my head. And then once I told my oncologist and I showed her like the headaches and everything, she was like, no, this is a real thing that you'll experience with chemo. And then, she was like, we'll slow down the rate that it's administered into your body, the chemo, which in turn really helped me. Like I stopped getting severe headaches. And so it's really important. That's why I'm going to re-emphasize, it's really important to like your medical team. If you have to go through this process of being diagnosed with cancer, you have to like who you're getting treated by. And, I'm really happy that she listened to me in that first time that I've mentioned something, and then continuously listens to me. And she kind of treats me like her friend in a way, which I like, because other times at medical appointments for like other things, like people will just look at me for my age and be like, oh, she's so young to have cancer. So it's just really nice to, be acknowledged, and my like feelings be acknowledged as well of like what I'm going through. So bring a notebook. I wrote down everything, even like the things that she told me that I was going to go through. I wrote it down so I can like research it later. My surgeon, Dr. Port, she wrote a really amazing book. And it like goes through everything, like, having the genetic mutation, getting diagnosed, the different types of breast cancer. There's a section about breast cancer myths, which I really love, because like the first thing I heard from people in the brown community was like sugar feeds cancer. And and you don't, you just want to like understand what's going on with you, and you don't want unsolicited medical advice, right? So I'm forgetting the name of the book, but I will send it to Anjali so she can send it out to you guys.
Yeah, we'll get it up on the SAWAS Instagram. Well, thank you for those thoughts, because absolutely, like making sure your medical team knows what you're going through and vice versa, so they can help you. Simran, I saw.
Just as a physician, but also as a genetic mutation carrier, I think my thoughts are that knowing about the mutation means that the more you know, the more power you have. So the saying goes, knowledge is power. Having said that, though, it doesn't necessarily mean, and I've learned this kind of the hard way, I love everyone in my family. And so just because I wanted to find out about my mutation doesn't necessarily mean everybody is ready to find out if they have it or not. And so I think if just to the point of if someone out there knows about it and they want to share it, you have to really make sure that the people you're sharing it with are ready to hear that information. Because if they're still in the pre-contemplative phase, all you can really do is support them and give them information, but not like push them, because then that will cause a lot of tension on your relationship. And you just don't know when something's going to click in someone and when they'll be ready, and then you can be there for them. But we try to do a lot of things out of love, and love can be pushy sometimes. So, and then the other piece of it is as a palliative care physician, I'm huge on informed consent, so people can refuse genetic testing as long as it's an informed decision. So do they know the benefits, the risks, the alternatives? So as long as that's, they know that, then they can refuse it, and that's fine. And I also have a book that was huge for me, and it's actually by Dr. Christy Funk. She was Angelina Jolie's surgeon. That book was amazing. It's called Breasts, the Owner's Manual. I loved it, and it was super helpful. So if anyone out there could use it, I would recommend it.
And she's also plant-based like we are.
Yeah.
So that's how actually Simran and I originally communicated and bonded on Instagram, and then shared that she was a BRCA1 diagnosis at the time, and now Previvor. Reema, any thoughts that we haven't already touched on?
No, you guys have pretty much summed it. Like Roshni was saying, definitely keep, a log of your symptoms as a patient, because a lot of times when you go see the doctor, you might not be feeling that symptom, and you might not be able to relate to them. So it's better to have everything written down, all your questions and stuff, because a lot of times when you see some patients don't really open up as much because they can't remember. So it's best to write down everything too, because then, especially with healthcare, everybody's allotted this much time. So if you don't come prepared, your question might not get answered. So that's something I think it's very, very important as a physician and as a patient that I always tell my patients too. And the other thing is, like Simran was saying, not everybody is open to their diagnosis. Like even with my sister, she is very private. Meanwhile, I have a whole blog about it. So when I started sharing my cancer diagnosis, people did question me, like, why would you want to share? I'm like, why not? It's not something that I closet on myself. Why? It's not a taboo. It's not something that I'm embarrassed about. I just want people to be empowered by it. Like, even as a physician, I am not immune to these diseases. Like, I'm a patient also. So, and if I could touch one, and the feedback I've gotten from a lot of young women, or and it just makes it more powerful and more meaningful. Like, yeah, I want to continue sharing because they don't have someone else that they could talk to, so at least they have somebody who's relating to sharing their personal journey. Because like, as you've said, Anjali, like in South Asian community, everything is like hush hush, don't say it. And that means it never happened. I mean, that mentality unfortunately exists even in 2020. So
Yeah.
I think you're doing a phenomenal job with your Instagram too, like, always advocating for preventative medicine and breast health. And so I am just grateful that I've connected with all of you, and I will continue to share whatever I can and be open and honest about it. Obviously, nothing is sugar coated, or
Yeah, no, this has been, I feel like I've learned tonight too from all of you. Amani, anything that you, from a breast surgeon's perspective, that you want to touch on?
Yeah, so I definitely agree with all of you. Write things down, but also when you first meet your cancer surgeon or your medical oncologist, I actually recommend that you, or if they're allowing visitors, record the whole visit so you can go back and listen to it later. Because a lot of times, like, it's so much information. And I see it all the time with my patients, their eyes just glaze over because it's just so much information that we're unpacking. And even if we're spending 2 hours together, which we often do, it's just a lot. And so not everyone processes at that pace to be able to get that information. So it helps to have it recorded, and also so family members who aren't able to be there can hear exactly what came out of the surgeon or the medical oncologist's mouth, and not like your interpretation of what they said, because sometimes those aren't exactly the same thing depending on how much information you're getting at that time. And the other thing I wanted to touch on, which is something Reema just said, yes, there are modifiable risk factors, and sure, like having a plant-based diet and being healthier and not being obese are modifiable risk factors to a certain extent. But patients come in and ask me every single day, like, why did I get this cancer? What did I do? Was it something I ate? Was it something that... The moral of the story is there's nothing that you did. Cancer is not your fault. 99% of it comes down to bad luck. So it's okay to talk about it. It's okay for family members to ask about it. It's okay to have open and honest discussions about it, because just because someone was diagnosed with breast cancer doesn't mean that they were living their life in any way that they shouldn't have. And it's not a judgment on them. And it's not a statement of, of the choices that they've made. So if you are in that situation, I hope you know that it's not your fault. Nothing you did could have prevented it. Nothing that you did caused it, but we're going to take care of you.
Yeah, I echo that. I've said it before. Our top 2 risk factors to the development of breast cancer are being female and aging, neither of which we can change being female, and we can, try to reverse aging, but the risks that those impart, even for, transgender men, transgender women, just that estrogen from being a woman, places you at risk for the development of breast cancer. So absolutely agree with that. There are, when we talk about doing things to improve our health and decrease our risk, that's not trying to place the onus on you that it's your fault when when and if you do get it. So I think this has been really, really
One
awesome.
last thing, actually. And Amani, I don't know how you feel about this, but I just want to throw a little piece out there, because having been in multiple support groups over the last 6 months or so, I've heard time and time again, kind of what, Roshni and Reema also touched on, is that sometimes you go to see the oncologist and you're talking about the next treatment and the next imaging study, and you don't necessarily have enough time to talk about all the symptoms or the psychosocial or the emotional aspect of everything you're going through, because this is really a physical, mental, emotional, spiritual journey for people. And so I always like to throw this out there, because palliative care, people always think of it as hospice care, and they're two very separate things. Hospice is end of life care for people that are in the last several months of life, but palliative care is for anyone that is diagnosed with a serious illness, regardless of whether it's any stage of cancer or heart disease, whatever it is. And so I always tell people that I meet that if you're having a lot of symptoms and your oncologist doesn't necessarily have all the time to sit down and go through each symptom at your cancer center, they probably have a palliative care team, and they would be a great resource to help you through any symptom you have, or psychological concerns or emotional concerns. And they usually come with a social worker and a chaplain and a whole interdisciplinary team that could be there for you with your cancer doctors. So I always like to just throw that out there, because there's a lot of misconceptions in the medical field about palliative care, but also in the general population.
No, that's awesome. Thank you for bringing that up. So with that, this has been really great. Again, I feel like I've learned from you ladies. So thank you all for being a part of this. We have resources on both the South Asian Docs Instagram page, as well as our website. But just in case people are only catching this on YouTube, if we can all just go around and share our Instagram handles, how people can contact us if they have any other questions. So I'll start. I'm at Anjali Malik MD. Roshni?
I'm at Rush_Knee, KNEE_.
Awesome. Reema?
Daily Dose by Dr. J.
Simran?
I'm at Dr. Simran.Malhotra.
And Amani?
I'm at AJ Victory MD, and I just want to say thank you so much for putting this together and for moderating, Anjali. This was an awesome session.
Thank you.
Yes,
Yeah,
yes,
I think
thank
so
you.
as well. And I hope that if anyone has any questions, get in touch with us. And thank you again to everybody.
all right. Have a good night.